Hello, this is Mr. Coco. Welcome to my page. We're looking at today. We're looking at the Glasgow Coma scale chart. So Glasgow Coma scale chart, as you know, the people working in hospitals or those who are just starting in foundation, this chart is used for patients who have maybe say head injury because want to assess their level of consciousness. So mostly you'd find that post-RTA patients, or I can say road traffic accident patients, they may lose consciousness. So when they lose consciousness, we have to know the level of consciousness because we need to know if this patient is recovering or not recovering. So the tool that we use to assess whether the patient is recovering from that head injury or not recovering is called a Glasgow Coma scale chart. So it's very important that you follow through. There are just a few things that you'll be able to see that have been put together to come up with this tool. So let's start with what's on top there. On top there, when you receive a patient, say today, you're going to say this patient has been admitted, which is date of admission. So we'll start with the name. So we start with the name. So for example, this is Mr. Chihuahua. That's the name. So Mr. Chihuahua. So you indicate Mr. Chihuahua there. And then since they've been given record number, so Mr. Chihuahua, then even their name, another name there. Then the record number is 2214. So you have to record the record number. It's very important that you know the file number for this patient. Then you have to go to the age. So Mr. Chihuahua is 26 years old, and then it's a male patient. Then we have to go now to date of admission. Today is 12th, so you indicate 12. That's 0322. So you indicate the date of admission up there. Then you go to the diagnosis. The diagnosis meaning what this patient is suffering from. For those who are just joining nursing, this is what the patient is being said to be having, or the problem the patient has. So let's say the problem here or diagnosis is head injury. Head injury. So you specify there. So that's there you need to indicate. Then now what you need to follow is these parameters. So the Glasgow Coma scale is divided. Okay, so since it's divided, you start with the first division, which has three things here. So the first division we're looking at is the Coma scale. So it has the Coma scale. So this Coma scale, that's the first division we're looking at. So the Coma scale has what we're calling eye opening or eye open, then best verbal response, and best motor response. So these are the three parameters under the Coma scale. So for you to monitor the Coma scale, you need to go to the patient. So what you need to do to the patient, you need to start with eye opening. Now, under eye opening, you have to also consider some things. For example, if the eye is not opening because, if you look at this other end, eyes closed because of swelling. So you need to indicate the C there because eye is not opening because of the swelling. But then if there is no swelling, now let's go, we assume there is no swelling. We're going to get to Mr. Chihuahua. So as we get to Mr. Chihuahua there, in here, we're supposed to indicate now the time. So for example, the time that we are doing this reading is 10 hours. So indicate 10 hours there. So you keep indicating the time. So this is 10 hours. So Mr. Chihuahua, we get there, then we check out. As we get to the bedside of the patient, is Mr. Chihuahua able to open eyes without us calling him or pinching him? So we have to know. So if we get there, we need to see if his eyes are just opening spontaneously, meaning he just opens his eyes without calling him or pinching him. So the count here is supposed to start with down here, which is this is 1, then this gives us a 2, this gives us a 3, this will give us a 4. So then Mr. Chihuahua opens eyes spontaneously. If he opens eyes spontaneously just by us or me entering the room or just going by the bedside, I have to tick there, that box. Now I want to tick first, let me go to speech. For example, if I say I go there in the room, he doesn't open his eyes. I have to pinch Mr. Chihuahua. I have to just go to speech. I have to call his name out. I have to call him Mr. Chihuahua, Mr. Chihuahua. So if he opens his eyes to speech, meaning I've called him, meaning I will tick there. For example, I enter in the room now. He doesn't open his eyes spontaneously. I call out his name. He doesn't open, meaning I'll not tick there. If I pinch him, then he opens his eyes, meaning I'll give him a 2 there. So I'll just tick. If, for example, I enter in the room again, he doesn't open his eyes spontaneously. Then he also doesn't open his eyes when I call him. Then he doesn't open his eyes when I pinch him. I have to score a 1, meaning I have to tick there. So I have to just tick once according to the patient's response. So let's say, for example, I enter the room. I enter, he doesn't open up his eyes. I call him, he doesn't open up his eyes. When I pinch him, that's when he opens up his eyes. So I'll tick there, like that. Meaning my patient has scored 2 to eye opening. So eye opening, he has scored a 2, so which is to pen. Then I can move on to the next one, which is best verbal response. This best verbal response is the patient now trying to tell me something or talk to me. Will the patient be able to talk to me in a normal way, or maybe there will be some changes according to the problem that he's experiencing? So also this starts downwards with the marks, the grades. So 1 there, 2, 3, 4, then gives us a 5 as the highest score. So the highest score has given us a 5. Then on eye opening gave us a 4. On best verbal response, the highest is 5. So the way we do it is similar to eye opening. So best verbal, I have to ask Mr. Chihuahua these the 3 things here. So when I ask him, I have to ask if he's oriented to time. He has to say the time, so, and also the name and place. So we have to look at these 3 things. So I have to ask Mr. Chihuahua, Mr. Chihuahua, what is your name? If he's able to say he's Mr. Chihuahua, then I have to go to the next one. Mr. Chihuahua, where are you? Meaning he would tell me, oh, he's at the hospital. Then what time is it? Is it afternoon, morning, or evening? Mr. Chihuahua will be able to tell me it's morning or evening. So these 3 things, name, time, and place, you need to ask. So you can ask his name, you can ask what time it is, you can ask the place. Then meaning if Mr. Chihuahua is able to answer all the 3 correctly, you will give him a score which is 5 here, which is oriented. You can tick. But then if you ask the 3, name, time, and place, then Mr. Chihuahua is confusing his name and the time. He doesn't know what time it is, whether morning, afternoon, or evening. Then again, you ask for the place. He doesn't know whether he's in hospital or the place where he is. So meaning there is confused because is disoriented to this. So you can score him a 4, which is confused. Then you go to 3, inappropriate words. Here, inappropriate. Then Mr. Chihuahua, you ask Mr. Chihuahua, what is your name? Then he tells you, my grandmother is in Samfia. So you say these are inappropriate words according to the question, which is name. We're supposed to give you name, but it tells you about the grandmother who is in Samfia. Then ask him about time. He tells you, no, I work in a factory. So meaning is disoriented also to this. So these are inappropriate words. So you are going to score Mr. Chihuahua on 3, which is inappropriate words. Then, for example, he's not oriented, he's not confused, he's not giving you inappropriate words. Then he gives you incomprehensible sounds. Incomprehensible sound, we mean those sounds which are more like just humming. You cannot even get what he's saying clearly. For example, so those words are called incomprehensible sounds because you cannot clearly get what the patient is saying. So you score him a 2. And then what about if he does not give you, is not oriented, is not confused, he is not giving you inappropriate words, he's not producing incomprehensible sounds? Then you score him a 1, which is none, because he's not doing any of the above. So you score him a none. So now let's take a scenario whereby you ask Mr. Chihuahua the name, and you also he tells you he works. You ask him his name, he tells you he works in a factory. You ask about the time, he tells you that my grandmother will be coming. Then you ask him about the place, where are you? He tells you, oh, once I was born, I was a big boy. Just gives you something that is not really related to the question. So you're going to say he's confused. So you score him on confused. So you tick on confused. So you give him a 4. So you just tick according to what the patient is saying. Then what about best motor response? So best motor response has 6. So you start with 1, which is none. Then you go to 2, 3, 4, 5, 6. So it has 6 scores. So you start 1, 2, 3, 4, 5, 6. That's what it gives you. So the highest score is obeying commands. So on this one, we're going to ask Mr. Chihuahua to do some things. For example, we're going to ask him to raise his arm. So you're going to say, okay, raise up your right arm. If he does that, meaning you're going to score him a 6, which is the highest score. Then if he doesn't raise up his arm, what do? You go to the next one, because he's not obeying commands. He's not able to do what you're telling him. Say, for example, raise up your left arm. He doesn't do it. So what do? You go to the next, which is localizing pen. Now, to localize pen is whereby you're going to pinch Mr. Chihuahua, say, for example, on his right arm. When you pinch Mr. Chihuahua on his right arm, he's supposed to really just touch or show you that where you've pinched is the right arm. So if he shows you to say that you've pinched the right arm, after you pinching him, he touches it, or he does something to show you that he did get where you're pinching, so you're going to score a 5. Then what about if he doesn't localize pen? Where do you go? You have to go to number 4, which is withdrawal from stimulus. So, for example, you pinch his right arm. You're supposed to move his right arm to show you that he's feeling pain. When he withdraws from stimulus, meaning he's moved his arm, the right arm, away. You pinch him, he moves it away. So, meaning that way you're going to score him on a 4. So, what about if he doesn't withdraw? You pinch him, he doesn't withdraw. You pinch him, doesn't localize. Then it's not even obeying commands. So meaning you have to go to 3, which is abnormal flexion. So abnormal flexion, to flex, mostly you know that it's to bend your arm or to bend your knee. But then what happens is that when you pinch this Mr. Chihuahua, instead of flexing the arm or folding the legs, Mr. Chihuahua there with his arms and legs, he will fold them inwards. So mostly he will fold inwards. So meaning the flexion will go inwards. Even for the limbs, it will go inwards. Meaning that's not normal. So the feet will go inwards. Even the arms will go more like on the chest. So that's what we call decortication or to decorticate. So that's what you will do on abnormal flexion. Then what about if it doesn't give you abnormal flexion? Where do you go? So meaning you have to go on abnormal extension. So abnormal extension is opposite of abnormal flexion. So instead of folding inwards, you go, the arms will be folded outwards. Even the limbs will go like that in his bed. So they'll go outwards like that. So this will be abnormal extension of the limbs, which is upper limbs and lower limbs. So that's what will give you after you pinch him. So now what about, so that's what we are calling to decelerate. That's 2, abnormal extension or decelerate. Then what about if he doesn't give you any of the above? He doesn't obey commands, he doesn't localize the pen, he doesn't withdraw when you pinch him, he doesn't do abnormal flexion, doesn't do abnormal extension. You score him a 1. So let's take, for instance, now we say that Mr. Chihuahua is able to localize pen. So for example, you pinch him and then he moves to show you that he moves his arm to show you that he's able to feel the pen on his right arm we have pinched. So you're going to score him on localizing pen. So therefore, we're going to count now the score to give you the Glasgow Coma scale score. We're going to count. Let's start from here. Let's start from the top one. So we're going to add 2. 2 plus 4, it gives you, that's a 6. Then 6 plus 5, it gives you 11. So we're going to say that at this hour, you have 11 over 15. That's GCS, so it gives you 11 over 15. Because your score at this moment is 11, then it's out of 15. Because if you add all these, say for example, 6, which is the highest score, plus 5 plus 4. So 4 plus 5 plus 6, it gives you 15. So that's why the Glasgow Coma scale is out of 15. So the total score it gives you, you're going to write 11 over 15. So that's the Coma scale. Then there are other things that you just do to support your can say your findings or your vitals. So you're going to also do, you're going to check the pupil size. So meaning this, you're supposed to use a torch to check his eye, and then you're supposed to record according to the pupil size. You're supposed to record the number, whether it's a 1 or 2 according to the pupil size. So check with a torch, then find a scale so that you get the size according to these here, 1 up to 8. So you're going to record them. Okay, so we're going to also now use this chart, right and left. So size reaction, so we're going to record 1 to 8. You're going to pick according to the size he's given you there. So we're going to have each eye recorded separately there. The right eye separate. So we're going to record the size here, and then the reaction of the eye. Is it reacting or not reacting? We're going to tick. So even the left, you do the same. So right eye, size, and reaction, just record there. Then other things that you're supposed to do is blood pressure. You should also take blood pressure. You're supposed to indicate it just in this same line. You're going to indicate in this same line here in red. So for example, is 110, or I can say 120 over 90. So I'm going to say 120 over 90. Then you're going to indicate like that. Then there on pupil size, we said that it's reacting. Then the size is 5. Okay. Then you go to respirations. You counted. Then maybe it gave you 22. So I'm going to record there 22 for respirations. Then on pulse there, you're going to put it in blue. So I'm going to record, for example, his pulse is 80. So I'm going to put pulse there. Okay. So then what about temperature? So temperature gives us a range this side, but we're going to record this side. So it's 36 point, it's supposed to be 36. So this is 40, and this is somewhere there. So as you can see, so this is 39, 37, 36. So 36 is there, so it's supposed to record what is given you. So meaning, as you do that, you're going to have at least your readings arranged like that. So for pupil size, you can put reacting or not reacting. So some people would put a plus here just to show that it's reacting. If it's not reacting, you put a minus. So that's how it's going to appear after you finish everything. So this is a Glasgow Coma scale, and you have to practice for you to know what to do with it. Then what about those people who do not talk? In case they have an endotracheal tube, you should indicate a T so that you include it here, so that it shows that the patient is not able to talk because they've got a tube in the mouth. Okay, so this is how you're supposed to do it, and hope you have learned, and just practice so that you at least you get all the details together. Thank you very much for your attention.